This is Chapter 13, Productivity and Accountability. Accountability is the state of being responsible or liable for actions taken. Managers are accountable to a lot of different entities, including suppliers, employees, customers, and other constituencies for what they do, as well as for the work of their subordinates. It also includes a sense of duty to ensure that the proper services and goods are provided and individuals are treated fairly. Accountability measures a lot of different things for performance, and we're going to talk about three different areas: productivity, financial, and human resources. The measures are compared to both internal and external standards through a process called benchmarking, and we'll talk more in detail about benchmarking in the end of this presentation. Businesses and organizations are accountable to a lot of constituencies, including vendors. So these are all of the different organizations that provide the product to the organization. So in a food service environment, this could be like a Shamrock or a produce vendor, something to that effect. And they're entitled to timely payments and getting their payment on time so that they can continue working with them. Financial backers. So for anybody who's actually invested in an organization, this is common in a retail food service environment. They may have individuals who have supplied money and investing in the business, so they should receive a reasonable return on their investment. On the other side, if the financial backers are taxpayers, for instance, like the National School Lunch Program, they're entitled to safety and quality of the product that they're receiving. Other constituencies include employees. Employees, as an employee, you're entitled to a safe and harassment-free workplace. You're also entitled to fair wages based on the work that you provide and equitable treatment. And these are covered, of course, in a lot of the different acts that we discussed earlier, like the Civil Rights Act and the Americans with Disabilities Act. Customers, they expect the following: that products are going to be safe and that they're performing as advertised. Customers can be both internal and external. And what does that mean? So external customers are the end user of the organization's product or service. So this could be patients in a hospital, for example. Internal customers are the individuals within the organization who provide the services to the external customers. So this would be the doctors, the nurses, any of the healthcare staff who care for the patients in the hospital. When the public lacks the information to determine the quality of goods and services, the government or non-governmental accrediting agencies can provide oversight. So if you've ever worked in a hospital or healthcare facility, you're probably very familiar with the Joint Commission. They have multiple series of standards that they uphold organizations, particularly healthcare organizations, to. So if you're wondering what kind of standards should be in place, they're the ones that you can go to look at as far as if a facility is following all the rules and laws that they are required to follow. Same thing with Center for Medicare and Medicaid Services. A second, what we'll talk about is productivity and different things we need to be accountable for. So productivity is the measurement of the relationship between outputs or products and inputs, such as time, money, labor, or raw material. And we can look at this productivity in different measures, such as quantitative, qualitative, and relate those to those outcomes. Quantitative measures, this kind of measure focuses on numbers. And this is probably what a lot of individuals are used to, and particularly in food service. Looking at the number of items you produce, the amount of customers that are served, the time that's required to make those items or the menu, the amount of labor that's been utilized, and even maybe the type of labor. How many cooks did you have? How many tray line staff did you have? And it also looks at the cost of material. And as you're probably aware, in food service, the cost of material fluctuates pretty consistently. Food costs especially when we're talking about produce or proteins, they're never a consistent amount, right? They will vary depending on their availability, whether it's in season or if there's been droughts or a lack of a product. So this particular area, it does fluctuate quite a bit, and it's one that managers definitely need to keep on top of and be aware of for their cost of their materials. For a hospital tray line, the following calculations can be used for an internal comparison. And so these are pretty common the numbers or values that are looked at. So trays per minute or minutes per tray. And so this number can be calculated, and then we'll talk about in a little bit benchmarking and being able to measure your productivity, the trays per minute, how it's been consistent over a period of time, if it's gone up or down, and likewise with minutes per tray, how long it took to assemble each particular tray. Other ways to measure productivity in a hospital: labor minutes per tray, labor hours per tray, and then trays per FTE. Remember that full-time equivalent. So as a manager, there's lots of data that you can utilize and look at to determine how efficient your staff is producing the meals. Now, not one of these calculations is the end-all be-all. Most managers do look at a couple different versions of these. So they may use labor minutes per tray. They may do trays per minute. They may use a variety of these different calculations to determine the productivity. Qualitative measures are another area you can look at, and they're concerned with the accuracy and the quality of what's produced. So quality can be a bit subjective, along with taste and temperature. Temperature is really not subjective, but appearance can be subjective, neatness, accuracy. So some of these are really going to vary depending on your menu, as well as the manager's preferences, the patient's preferences, and the like. Temperature is definitely one that's an easy measurement and one that should always be done in a food service environment, keeping track of food temperatures where they should be, even if it's for just a food safety issue, let alone a quality control issue. Outcome measures determine whether or not a product did what it was supposed to do. So some of this data that you're looking at, what does it actually tell you? Okay, well, if you look down at the bottom, so you're in your food service examples, if I'm taking temperatures or if I'm tasting the food, I'm then measuring sensory characteristics of the food. Was the meatloaf too salty? Was it just savory enough? Was it hot enough for food safety? Is it going to kill all the bacteria and ensure that my patients are not going to be given food that's unsafe and maybe even further their, or weaken their immune system even more? So you use these measurements for a lot of different areas depending on what you are trying to focus on. In clinical nutrition, changes in health outcomes after nutrition counseling. This is a hard one to measure, but it can be done, and it shows the effectiveness of providing that type of information within a clinical environment. Community example could include birth weight of infants to mothers on WIC, so showing the education and being able to have a healthy birth weight of a baby while the mother was receiving education on healthy nutrition at WIC. That could be an outcome, for example. So productivity measures and outcome measures are ones that pretty much every organization does track. They want to show that what they're doing is effective. Information gathered when determining productivity can be used for, in addition to showing effectiveness, it can also help determine how much staff you need. This is very helpful, particularly when trying to justify hiring new staff. If you're showing that your productivity is declining, or if you had an additional FTE, your effectiveness and your productivity could go up. So that kind of data is often helpful trying to justify an additional FTE. Can also help with monitoring adjustments to changes in a work process. So a new type of tray line or a new setup, a new menu item, or even a whole new change from tray line to an in-room service environment, which is going to change drastically how you're producing meals. Being able to have a measurement in place to be able to compare pre and post can be very, very helpful to show how effective those changes are working or maybe not working and what kind of changes need to be made. And then quality management, the quality of the product, being able to improve the processes and the overall methods of being able to produce that product. So we're going to talk about a couple different things in quality management, some different acronyms here. So we have quality control, which is QC. This is a method to determine if the products made meet a minimum standard of acceptability. And in food service, this typically has a temperature associated with it. It could have a portion size associated with it, potentially even a taste associated with it. Again, that's a subjective evaluation, but a lot of times quality control does typically relate to a temperature and an appearance of some sort. Quality assurance is the process of identifying and solving problems within a department or area of an organization. So if you're having issues with getting trays out on time or getting trays up to the floor and served before they get cold, quality assurance can help with that piece of identifying where the problem's occurring and how can you go about solving those to make it more efficient. A continuous quality improvement, or CQI, is really the process of identifying areas in a department that could be strengthened and working to make those areas better. So while the previous one was looking at areas where you're not working well, quality CQI is really looking at areas that are already pretty doing well, but maybe can even be strengthened and do better and making them even more efficient than they had previously. And then TQM, or Total Quality Management, is the application of the quality managed processes throughout the organization. So it's not only looking at a specific department, but it's looking at the organization as a whole and how they can work better and more efficient together. All right, as mentioned earlier in this recording, we were going to talk about benchmarking and what that means. So benchmarking is pretty common in a lot of organizations, and it's a practice of measuring performance and productivity against standards. And you can either do that internally or externally. Well, what does that mean? So if I were to do an internal benchmark, this is the process of essentially comparing my own data or on productivity with past performance and comparing how am I doing currently to what we did in the past. Variations, if you have issues, can alert the manager to changes and potential problems that may be occurring. It can also identify areas when maybe if you've lost a series of employees and then you see the management would not allow you to replace those employees and all of a sudden your productivity has declined. This is a good way to then identify and show your upper management that those individuals, those positions need to be filled in order to increase the productivity, those maybe trays per minute or whatever that case may be. Managers can also look at patterns and trends and can help guide changes in staffing. And this is helpful in a lot of organizations, particularly those that deal with seasonal changes. Food service industry is not an uncommon one to deal with those, over holidays, if they may have a higher traffic pattern, say during Thanksgiving and Christmas, maybe they decline and they're not as busy in the summer months, depending on where they're located. I know here in Arizona, when it becomes 110 degrees, people have a tendency to not go out as often, or maybe if they do go out, they're choosing lighter, cooler items. They don't want soup. They don't want heavy meals. And so looking at those patterns and trends can help management make changes and put them in place that are effective. So what's external benchmarking? Well, that's the process of an organization comparing its performance and productivity to a comparable organization. So McDonald's would look at how do they compare to Burger King, or another like chain quick serve kind of restaurant, and they can look and see whether they're performing at or above, or even below the industry standard. And a lot of industry sites track this type of information. So they can be, managers can go in and look at those general that data pool that's been pulled and compare their own productivity measures to those of a like or a similar organization. For instance, some of those are listed here, some industry-wide benchmarks for healthcare and restaurants. So Press Ganey is definitely one that a lot of hospitals look at for customer service and feedback from their patients that are being surveyed at the end of their care at the hospital. And then restaurant.org, that's an interesting one. They collect a lot of data on different types of restaurants in varying levels of service. So whether that's fine dining to quick serve, and being able to compare the service and the productivity to each of those. So benchmarking externally can be challenging because you're trying to find somebody that's comparable to you, but these individual organizations and websites can help you identify and to do that.